This video will cover mast cell neoplasms. The anchor is simple. This one is for all my dog people out there. Let me know what kind of dogs you have. I'm always happy to get some joy from that. Notice the dog in this image is a mastiff. A mastiff is our symbol for mast cells, for obvious reasons. Cutaneous mastocytosis is defined by usually a solitary lesion involving the dermis. This is represented by this one solitary skincare product back here named dermis. When there is widespread disease with bone marrow involvement, then it is called systemic mastocytosis. Our symbol for bone marrow is bone broth, which our mastiff will be enjoying sometime soon. Systemic mastocytosis appears in the marrow as spindled or round cell infiltrates. No problem for this one, since we all should just know what mast cells look like, both when they are normal and abnormal. A couple of things we can remember, however, is that these mast cell infiltrates in the marrow are usually accompanied by reticulin fibrosis and a smattering of eosinophils. Fibrosis is represented simply by this fiber 1 granola bar, for obvious reasons. Eosinophils are represented by this oatmeal because the word oatmeal sounds similar to eosinophil. I've even included some raspberries in the oatmeal to help us remember the orange-red granules. The neoplastic mast cells typically express CD25, CD2, and CD30. The symbol for CD25 is this Tweety character sitting on a hive. Tweety sounds like the number 20, right? And hive sounds like the number 5. Put that together and you get CD25. CD2 is represented simply by these cool shoes the mastiff has on. The word shoe sounds like the number 2, and I've even included the number 2 as a design on the shoes to really hammer it in. The prompt for CD30 is a hedgehog, as we know from prior videos. This is because CD30 is such an iconic stain supporting a diagnosis of Hodgkin lymphoma, and the word Hodgkin sounds like hedgehog. CD117 or c-KIT is expected to be positive but with diminished expression. I prefer to call it c-KIT instead of CD117 because we can easily remember it with a first aid kit. Also, notice how this first aid kit is called D816V. This is because the most common c-KIT mutation is the D816V mutation found in exon 816. As a little bonus, expression of CD25 correlates with the presence of c-KIT mutation, but no prompt to remember this one. Toluidine blue and Giemsa stains can be used to highlight the granules within mast cells. As we know from prior videos, granules are represented by sprinkles, and since these interesting sprinkles on the mastiff are blue, we'll remember toluidine blue. To help us remember Giemsa, take a look at its hat. Doesn't geek sound similar to Giemsa? One of the important diagnostic criteria is a serum tryptase of more than 20 nanograms per milliliter. The prompt for this is this suitcase, because you take suitcases when you go on trips, right? And trip sounds like tryptase. The mastiff loves his Tweety friend so much that he even put a Tweety sticker on his luggage. Since Tweety is our symbol for 20, that's how we'll remember serum tryptase of more than 20 nanograms per milliliter.